Audio Jungle. Audio Jungle.
Good morning, guys. If you haven't had a chance yet to see yesterday's video, please make an effort to go do that. You'll be way impressed with Manny and how fast his mouth moves now after his hygiene visit. We were talking about the power of positivity and just how powerful an impact positive attitude, positive words, positive affirmations can be. In his example, he was talking so much smoother and faster and couldn't wait to taste his food because of how good his mouth felt after his hygiene visit. Remember, that's the effort, that's the contribution we make to our patients with healthy, clean, and functioning mouths and the ability to say Peter Piper Pepper Pickle ultra fast. You'll know what I'm talking about if you've seen that video. Anyway, let's dive into where we're going today with the subject and topic, and that is how we're going to mitigate a few issues that have come up with our scheduling, with our patients in the office, and our conversations about how coronavirus is affecting us in the office. First, let's talk about time management and use of time with communication within the office. We want to be really sensitive and mindful about patients that are in the office and their time in the office. If we in the back are running behind and the patient's going to spend an extended amount of time up in reception waiting for their appointment, we probably need to be working a little bit better on our communication system. If we recognize that's happening in the back and what's coming, we need to, as a group in the back, communicate and push that message forward to the front so the front can ultimately communicate to the patients. We can alert the patients when there's delays. We can alert the patients that there's options. They can sit in their car and wait to come in. They can delay their arrival by a few minutes if necessary, but ultimately that can't happen from the front communicating to the patients until we in the back have recognized that challenge and push that communication forward. So please recognize where those opportunities are. Please make sure that we're pushing that communication forward. Now, let's talk also about scheduling of appointments and treatment at this point. There's a lot of buzz, a lot of uncertainty, and a lot of question about what constitutes appropriate dental treatment right now during coronavirus. Well, emergency treatment, urgent treatment are still all encouraged to ultimately take care of patients in the dental office. What that means is we want to be mindful when scheduling something that might be elective. Aesthetic or cosmetic dental procedures, dentistry is definitely elective. Other elective procedures might be routine fillings. Elective procedures might be orthodontics. Things like that are definitely elective. Things that are restoring a tooth because it's broken down, it's severely decayed, or deep decay that can progress into an infection imminently, root canals, extractions. All of these procedures are either emergency or urgent treatment protocol. If we're fixing a tooth that's on the verge of cracking or breaking, ultimately that becomes an urgent issue, and that is still recommended for us to proceed with treatment in the office. Hygiene, we're evaluating hygiene based on disease control. By Stefanik's protocol, hygiene is still disease control in periodontal therapy. So we will continue on as is with hygiene. We will continue on as is with restorative in the doctor's side, with the exception of making a little bit more discretion about elective treatments. If you have questions about what's elective and what's not, please make sure to ask one of the doctors, one of the office managers, or one of the hygienists, and we can facilitate a little bit better information there. If we're in the back and treatment planning, make sure that effort gets communicated also up front as best you can. Make sure you identify this is something elective, and so we can notate that toward the front when they're scheduling for upcoming treatment. That upcoming treatment that is elective, we'll let the patient know that since this is not emergency or urgent and it's an elective level procedure, we will schedule, but we'll schedule in a postponed fashion where let's plan 3 weeks out from now. Talk within the office and make sure that that's an appropriate protocol for your timing, but let's plan at least about 3 weeks out right now, and we'll postpone further if necessary. But ultimately, right now, we're going to try and focus on that emergency and urgent care to follow in that guideline. Again, ask questions if necessary. All of this is going to still tie right back into everything we've been talking about. Dual alternative close, what better time to practice and work on that than when a bunch of schedule changes are occurring. So make sure that's part of your arsenal and your language and what you're using. Power positivity. People are scared, people are uncertain, and there's a lot going on. You have the ability to influence that in a positive way. So I'm very thankful and grateful that we can continue functioning as an office, that we can continue treating our patients, and that we aren't having to close down and send our patients away. There are some offices around us that are closing and sending patients away. I'm thankful that we can continue on that. The power of positivity has an effect and an impact to our patients and to us as a team. So thanks for being amazing. Huge shout out to the front office team who is helping with wiping and extra cleaning protocol when we need it. You guys are amazing. When we need you, you're always there for us. We're going to make sure that that communication stream from the back to the front to the back is all happening in a smooth fashion. Pay attention to that timing and our patients when they're in the office, and let's work on this today. And the next couple weeks, make sure we have a good functioning team. Have an awesome day, guys.